Hello, my name is Christella Dustimchiza, and I'm here to talk about connecting the dots, which is a presentation. Start with the outline. It's really a short presentation, but with the vital information. Start with the introduction, talking about what globalization is, then factors of globalization such as travel, international trade, and worldwide communication in relation with spread of diseases. And then lastly, I'll talk about how globalization changed methods to control diseases with specific examples, and then I conclude. In the introduction part, we need to understand that in this presentation we're going to understand how globalization factors affected partners of the spread of diseases, giving specific examples. And again, but let's explore what globalization is. Globalization defines how people are easily interconnected in various aspects such as economics, social, and political worldwide. Globalization affects people either directly through economy or indirectly in other aspects. Uh, with an example of HIV/AIDS as a result of globalization, uh, the rapid spread of infectious diseases is where HIV is included is linked with globalization. This is due to the fact that it is now easy for people to travel, causing health risks such as HIV/AIDS. When infected people travel to other countries, they can affect other people through unprotected sex and doing many bad other sexual behaviors. And, and again, through communication, it's now easy for people to communicate through media's channel. Some people get wrong information from different media, causing them to be affected with AIDS. For instance, we know that the main cause of sex is having unprotected sex. However, also through transfusion of blood, AIDS can be transmitted. So it's better through communication. Sometimes people get false information that where they're eager to find the best prevention of the disease. And again, globalization has made it easy for international trade and businessmen invest in different countries. Uh, However, these business people sometimes involve in different behaviors, such as sexual behaviors, which also lead to HIV/AIDS worldwide. Here there is a table showing how HIV has affected the world, and the current statistical data are in the table below. I will talk about how the effect on global and again on sub-Saharan region, which is mostly affected. As you see in the table shows how sub-Saharan Africa is the worst region of the world where HIV is worst. People who live with HIV currently in 2018, 42 million people worldwide have AIDS, and then in three quarters of the people who live with HIV are mostly found in sub-Saharan region where 31 million people have AIDS, and the death estimated in 2002 was that 3.1 million deaths globally were estimated, while in those deaths 2.4 million deaths were found in sub-Saharan region. This is really a threat to the world because many people are being infected with HIV, which is really a problem. Uh, Again, I'm going to talk about diabetes, which is in part of non-communicable diseases as a result of globalization. Non-communicable diseases such as diabetes also count as the main health risk related to globalization through the same risk factors: international trade, travel, and communication. Looking at the trade, international trade, globalization impacted industrialized countries to trade from different countries, providing universal beverages, and then fast foods replacing the traditional diets with fat and calorie-rich foods. This was indicated by World Health Organization, and it's really impacting the whole world because many people are eating traditional diets, but nowadays we because of work, because of different things, we have been exposed to those soft beverages from the industries and then fast foods causing leading to diabetes. And again, on the side of communication, it has increased the sharing of ideas, cultures, and lifestyle from different countries through advertisement and marketing of different harmful products such as tobacco, and other types of foods which are really harmful to our body and making us to suffer from diabetes. And then lastly, talking about how travels and free mobility of people across the world has led to changes in eating habits, leading to various diseases such as diabetes. Here there is a statistical data showing the risk factors of diabetes, and they're showing that as the tobacco is one of them, and then also followed by excess salt or sodium intake, and again alcohol use and insufficient physical activity. Looking at the charts, we can see that the products here, the main products are the ones that are leading factors of to cause diabetes, whereas insufficient physical activity, which also has is a problem, but the main three are were caused by globalization because of industrialized uh, industries from developed countries targeting the developing countries and bringing tobacco in, and then alcohol and many other beverages that would lead to diabetes. This is all through trade and also communication. And then I will talk about how globalization changed methods for for disease control. The development of use of vaccine to prevent spread of the diseases. This is one of the methods. In different parts of the world, children below 5 years are given polio or measles vaccines uh, while they are below 5 years to prevent them from suffering from the diseases in the future. This is how globalization has changed some of the methods because there were um, and they made sure that they bring those vaccines to prevent the diseases from spreading all over. And again, the use of telemedicine to provide healthcare services due to the fact of distance between a patient and healthcare providers using both information and communication technologies. This method has been brought by globalization because nowadays people can use there was technology and then communication which which makes it easy for the patient and the healthcare provider to get in touch while they are at a distance. Uh, for instance, a doctor from India can be able to treat a person in another country using the is information and communication technologies where they are at a distance. This is really a change in disease control through globalization. And again, another approach is preventive care services that are now in place. Back then, without globalization, we should not the preventive care services should not have been taken place. But nowadays, because we know because of technologies, because of health literacy, people have now understood and that they can prevent the diseases before they suffer from it. And and they have understood that prevention is better than cure. Or for instance, a patient of diabetes or sorry, a patient can prevent non-communicable diseases such as diabetes through preventing himself from smoking, also or doing physical activities, which is now known to any individual. And without the doctors or healthcare care, care providers following them, they just know that it's there. They should manage their health. In the past, you would find that a person falls sick. This is when he knows that be he should take a diet in nutrition diety. But nowadays, people have understood that they should also take preventive services. As I conclude, we have to summarize what we have covered in this presentation. Through globalization, we have got some positive outcomes. However, we should all watch out for the negative part of it and then be able to find the suitable solutions for them. For instance, there should be policies that people should abide with related to trade. And again, travelers should think of taking vaccines and think of different outbreaks to prevent them from coming in the country. Again, regarding communication, adverts marketing channels should have facts about a particular disease to let the health divisions understand the preventive measures to take. Thank you so much for following the presentation.